sir, we are. I'm going to unmute everybody. Okay. Good afternoon, everybody.
Good afternoon.
This time I'll call the meeting of the Randolph County Board of Health, May 11th, 2020 to order. We welcome our community for joining us tonight. Our board members, as you can see, are joining us by Zoom meeting, so we appreciate everyone in attendance tonight. So at this time, I will call the meeting to order, and I'll need to do a roll call. So as I call your name, if you would state your first and last name and indicate that you're present. Courtney Wilson.
Courtney Austin Wilson, present.
Robert.
Robert Lee Brown, present.
Mary Ann.
Mary Ann Evans, present.
Okay. Carrie.
Carrie Hampton, present.
Hope Haywood is absent. She's attending the county commissioner meeting tonight. Julie May.
Julie May, present.
Lynn.
Lynn Richardson, present.
Ryan.
Ryan Snipes, present.
Mac.
Max Sunny, present.
I'm Marty Trotter, and I'm present. And Amy.
Amy Williams, present.
Okay, thank you, guys. Next on the agenda are public comments, and I will share that we had 2 public comments that were submitted, and I'm going to read those at this time. So the first one is from Christopher Huzzy. I'm just going to read it as he put in his email to me, okay? I feel strongly the reopen resolution needs to be withdrawn and or voted down on May the 11th. This is irresponsible on the part of our commissioners. I can't imagine why they would even consider such an action, as it jeopardizes the health and welfare of the people in this county, a responsibility they were elected to uphold and swore to do. Vote no. Again, that was from Christopher Huzzy. Second email that I received was from a Danita Baldwin Pitts. And this is actually addressed to the Randolph County Commissioners, but since it came to my mailbox on the Board of Health, I wanted to read this one as well. Dear Randolph County Board of Commissioners, I stand with Governor Cooper's 3-part plan to reopen North Carolina. I feel Governor Cooper should remain in control and not relinquish authority to local governments. Unfortunately, many elected officials lack the ability to remain impartial, use proper judgment, or remain unbiased during a decision-making due to the pressure from the citizens. There are some local governments who are using COVID-19 as an excuse to turn the reopen strategy into a political issue when it is a public health issue. This virus has proven deadly across many demographics and does not discriminate among the rich or poor, black or white, homosexual or heterosexual, Republican or Democrat. Social distancing guidelines are working and saving lives. I think Randolph County should go a step further and make it mandatory for everyone to wear a mask in public. As a nurse on the front lines at Duke University Hospital and an Asheboro native, it saddens me to witness on a daily basis local citizens not wearing masks and taking this deadly virus and not taking this deadly virus seriously. I see many families with children out in Walmart, Lowe's, grocery stores shopping as if there were in a state of normalcy. We are not. I see people coughing and not covering their mouths. I see people working on the front lines in grocery stores, restaurants, and service industries not wearing masks, and it is frightening. I often wonder how many of those people are asymptomatic carriers of COVID-19 and could be taking it home to an unsuspecting family member. Believe it or not, I have heard conversations about people who are positive with COVID-19 who are not staying home quarantined and going out in public without masks. Our own local hospital, who is unstable financially and most likely lacks an adequate catalog of personal protective equipment resources, is not equipped to handle a surge of COVID-19 patients. The number of cases in Randolph County continue to rise as of May 10, there were a total of 338 confirmed cases, up from 272 cases last published on May 5. That is 66 new cases in just 5 days. Although we are beginning to see a decrease in emergency department visits for respiratory illness, the number of ICU admissions have trended up. I'm going off data from the ncdhhs.gov website. I feel if we ease social distancing measures and reopen prematurely, we could see a spike in cases, increased deaths, and have to shut down again. I am all for religious services to continue safely with minimal exposure. This is a time for us to be innovative and creative with religious services while mitigating the potential spread of COVID-19. Mitigating the potential spread of COVID-19. We have a large elderly population with comorbidities here in Randolph County and numerous churches. If they were to open up, they would serve as one huge petri dish for COVID-19 and could prove fatal for many of our residents. Large religious gatherings have proven to be lethal in other states. Those pushing to reopen, ask yourself, can your family survive if the breadwinner of the family goes back to work and dies from COVID-19? What if we suffer a debilitating stroke from COVID-19, which is one of the possible side effects due to it causing clotting disorders? Is going back to work worth this risk? By the way, I have a friend that has had this experience. There are many frontline companies hiring as a demand for the products and services increase. I urge everyone to proceed with caution, to remain patient and vigilant, and let the scientific data be your guide. God bless us all. And that again was Danita Baldwin Pitts, registered nurse at Duke University Hospital. So we will have those two documented for public comment for our meeting tonight. Board members, in your packet, you should have received the minutes from March 10, 2019. Do I hear a motion to approve those minutes as presented?
I move to approve the minutes as presented.
Okay, we have
I second the motion.
Have a motion from Robert Brown. Who was the second? I'm sorry.
Courtney.
Courtney, okay. So we have a motion from Robert and a second from Courtney. Now, at this time, I'll go through each of the members' list and ask how you vote. Courtney, your vote?
Aye.
Robert?
Yay.
Mary Ann?
Aye.
Carrie?
Approved.
Julie?
Approve.
Lynn?
Approve.
Ryan?
Yay.
Mac?
Approve.
Marty? I vote aye. And Amy?
Aye.
Okay. Thank you. Motion carries. Next up on the agenda, we have the fiscal year 2020-2021 budget review. And at this time, I'll turn it over to Susan Hayes, Director of our Public Health.
Hi, everyone. You should have in your packet, you should have received our proposed budget. If you look on the very front page, that gives you the breakdown of what was approved last year when we made our request for this fiscal year that we're in right now. And what our base budget ended up being. That was after the commissioners passed the budget. There was a cost of living increase and other things, other monies that came in after that. The next column under requested budget shows you what we're requesting, and we have balanced back to what our budget was for this year. I take that back. I did that wrong. Let me start over. So you see on the first column what our approved budget was. We've got a base budget for the bare necessities of what we needed. And then our requested budget. We are requesting a position this year. And the position that we're requesting is a physician extender, a family nurse practitioner or a physician assistant. That has increased our budget roughly, our request for this year, $110,000. Also, our health insurance and retirement cost went up there's an additional $94,081 is an additional request in there because of the increases in our cost of insurance and retirement. We also had merits that were approved with the commissioner's budget last year or for this year. Those will be added into our budget going forward for the new year. That's $23,915. And then when we have retirees, we are required to make sure that we have enough in our budget to cover their insurance costs as well. That cost for this year, for the new year, will be $8,760. So we will be requesting $236,792 more for fiscal year 2020-21. So for our new fiscal year, we'll be requesting $236,792 for the new year. Do y'all have any questions about that? So tonight, I'm asking for approval of this budget so that we can send this to the commissioners as our request for the new fiscal year.
I make the motion to approve. Unless there's any discussion.
I'll second the approval. Carrie Hampton.
So we have a motion by Robert Brown and a carry by, a second, excuse me, by Carrie Hampton. Any discussion? Okay, we'll go back through the process. All of those who approve signify by stating aye. Courtney?
Aye.
Robert?
Aye.
Mary Ann?
Aye.
Carrie?
Aye.
Julie?
Aye.
Lynn?
Aye.
Ryan?
Aye.
Mac?
Aye.
I vote aye. And Amy?
Aye.
You skipped over. Did you skip Carrie?
No.
Okay.
All right, thank you.
Okay.
All right, the next item on the agenda is the fee schedule for the 2020-2021 fiscal year. So Susan, let's go over that with us.
Please.
Okay, at the back of the budget packet, you have a section that is fees. We usually submit these with our budget to the commissioners because once you approve them, they'll have to be approved by the county commissioners as well. The way each year we look at what our fees are on an annual basis and we survey other health departments of comparable size. We have comparison counties that the state assigns us, that we look at those counties and those around us to see what their fees are like. We also look at what Medicaid pays us. We look at what providers are paying for similar kinds of fees or services. We look at what our costs are. What do the services actually cost? And from that, we decide what we think is the fair and equitable charge for our services. So when we did that this year, you can see on the schedule, we've indicated in red if we thought we needed to increase our services or increase our fee for the service. And so if you look through, you can see those that we have increased. And again, they're based on cost, comparative fees with other counties, with other providers, and with what Medicaid reimburses us. So is there any questions about those fees that we've increased?
I have a question.
Yes, Mary Ann.
In the section right above pharmacy on page 4, CPT code 90736, lists Zostavax. Do you know, are you guys using Zostavax instead of the Shingrix vaccine? The Shingrix is preferred by the CDC.
We are not, I need to check on that. Do you know what the cost for that is by any chance?
It's a little bit more, and the disadvantage is that the Shingrix is a 2-dose series, so it is cost prohibitive in some cases, which I kind of expected you to say that's why you guys are still using the Zostavax, but I just wanted to put it out there to make sure you guys knew there was a newer preferred agent available.
So Marianne, let me explain. We don't actually offer, this is not a vaccine that we offer at this time, but we do include these vaccines in case we need to at some point in time. So it's all, you know, it's based on what's going on in the community, and rather than have to backtrack and add that fee in during the year, we just go ahead and include it in our set of fees. So what I will do is share with our clinic staff that Shingrix is the preferred vaccine if we decide we need to offer it to the public. But right now, we're not offering public private vaccines like you guys do. Primarily what we are offering are the state vaccines for children. People can come in and get a TB skin test or a tetanus shot if they've never had one. Those are all provided by the state. We do offer those, but we have not offered private vaccines because providers do that already, and so many pharmacies do that already. There hasn't been a need, but if we were to get in a situation kind of like we're in now with, you know, COVID-19, we might be in a situation where we need to offer it. So we include that in our fee schedule.
Right.
Does that make sense?
It does. And I just do want to reiterate, though, just that when you guys talk about it, the Shingrix is preferred by the CDC, but it is a 2-dose schedule. So
2-dose,
you
yeah.
you may find that even though it's preferred, it's not preferred for you.
Awesome. Yeah. Okay. Thank you for telling me that. Is there any other comments or questions?
Okay, board members, before we take a vote, I'll just point out a couple things. The health department fees, you'll notice a lot of those have not changed for the last 4 years since 2016. Some of those are a little bit newer. The environmental health have no change, proposed increases for the next year. And then the dental fees, there's a few of those. Most of those are actually new fees that they're looking at adding. So
I do need to talk about those new ones. I forgot.
at the bottom, okay.
So thank you. Thank you for pointing those out, Marty. I do want to point out, you've got they have this page on. Yes. In your packet, you've got a page which includes virtual pay. It's on page 4 of clinic fees, virtual patient communication and telephonic fees. Because we're trying to do as much as possible virtually, Medicaid is now allowing us to charge for some of these consultations as long as we follow a certain guideline. And so these are new fees that we've included in here as well. The other new fees are the CPR and the SIDS training. Those are things that we have never charged for before. But what we're finding is that funding for this is through our child care consultant nurse that's funded through Smart Start and the Partnership for Children. We're finding that we need to charge for those services now because the funding for her position is starting to be cut. We're not getting as much funding from the state for that position. So this is a way to, she does this training with a lot of child care centers, and it's just a way to cover the cost of the material so that we're not eating those costs.
Those would become effective June 1, correct?
Yes, thank you for reminding me of that. These fees would be effective June 1. We'll take these to the commissioners meeting at the June meeting for their approval. So if you approve the new, I guess I need two motions. One to approve the budget. Are these separate? They're separate, aren't they? We've already done the budget. We need a motion. I'm asking you to approve our fee schedule to go into effect July 1, but I'm also asking you to approve the new fees to be effective June 1st. Does that make sense?
Yeah.
Okay, so board members, we're looking for a motion to approve the fees. And just point out that the virtual patient communication telephonic fees will be effective June 1st, 2020. All other fees will be effective July 1st, 2020. So do I hear a motion?
I move to approve. Robert Brown.
Okay, Robert does the motion. Do I have a second?
I second. This is Lynn.
Okay, Lynn with a second. As before, we'll go through each member. Courtney, how do you vote?
Aye.
Okay. Robert?
Aye.
Mary Ann?
Aye.
Carrie?
Aye.
Julie?
Aye.
Lynn?
Aye.
Ryan?
Aye.
Matt?
Aye.
I vote aye. And Amy?
Aye.
Okay, thank you. Motion carries. Next on the agenda, we have the Health Director's Report. Susan?
It's a Susan show, isn't it? Okey doke. Just wanted to give you guys an update. First, I want to recognize Tara Aker. Tara has been, I guess, really and truly, Tara, April, and Dana Wright have been invaluable during the situation that we're in with COVID-19. The situation report that you get every day, Tara's got a team that puts this together, but without her, it would not be the caliber that it is. And I can't tell you how many emails that she sent out and how much communication she has provided to the county on a daily basis. So I really, I just cannot tell you how much I appreciate her. April and Dana work day and night. It is, I'm getting emails and texts at 2 o'clock in the morning, and they're doing contact tracing and case management. And these are nurses that have small children at home. So they are working 24/7 for our county. And I can't tell you how much I appreciate them and the work that they're doing. And they are invaluable as well. But overall, we have a tremendous team, not just the team that we have in the EOC, in our Emergency Operations Center, but the team we've got here at the Health Department. We're not here. Now, we're not far away. They can reach us by phone or email anytime, and we can pop over if we need to. But they are running this facility. We've got Darlene and Brooke. We've got our dentist who's running an emergency clinic. We've got Lindsay Saunders who's running clinic here at the Health Department. But our whole public health team is going above and beyond right now. At the EOC, we've got myself and Tara. We've got, we've split our nursing team in half so that one of them is always off 1 week, or not really off, they're working from home, because I can't lose one of them. If one of them were to get sick, we would be in a world of hurt. So right now, we've split our nursing team in half. So there's an A team and a B team. And I can't remember what week we're on, but April is at home this week, as is her coworker, which is Sandra McNeil. We've got Cindy Trogdon, she's at home. And so those 3 nurses work from home. Then this week, we've got the other 3 nurses working in the EOC. And we've done that strategically to keep us ready in case the worst happened and some of them got sick. We've also got our health education team in the EOC. They're doing all the Facebook stuff. They're doing tons of patient education and business education and all kinds of education pieces for us to put out to folks. We've also got 2 foreign language interpreters in the EOC that are helping us a lot with case management and contact tracing. And then we've got Sam Varner that we requested to come in because he already had a connection with our businesses in Randolph County through his corporate wellness coalition. It just made common sense to us to request that he come in, be our liaison with businesses. And that has worked out just fabulously. He has worked his tail feathers off, staying in contact with all of our businesses and providing them the education and the guidance that they need. And that is a full-time job. That would have taken one of my, we're not a big agency, so that would have taken a lot of hours from somebody I needed doing something else. And he's just done such a good job. We've also got Donovan Davis there, Jared Bird, emergency management director, which is Christy McCorkadile, and Evan Grady is there. When Christy's off, they split into 2 so that emergency management wouldn't get caught the same way should something happen. Jared and Donovan is split into 2, and Tara and I should, but we just can't let it go. So I don't know. We've talked about it, and it's just too hard to not be there every day, knowing what's going on. So that's kind of how we're operating. We have relocated. We've been there since the 1st of March. And as I said, the other folks are here and they're carrying on, and everybody is doing such a good job. And I'm just really, really proud of our team and wanted you to know that. Our case count today was 355 when I left. That will go up tonight. We'll typically get several more before the night's over. We are at 6 deaths right now. So we have know that we have community spread among a lot of the positives that we get. We don't, they will tell us they have no idea how they got it or where they got it. We were talking to someone we know actually who's been at home and is able to come back just a little bit ago before Tara and I came over here. And that person said, I have absolutely no clue where I could have gotten it. One of our family lost her husband and her father-in-law, one of our nurses. Their whole family became ill. Her husband was first, and he died about a week ago, 2 weeks ago now, 2 weeks now. And his father died probably a week or 2 before he did. So we, we're really sad about that. And she should be coming back soon, I think maybe this week. But she is still suffering some consequences from having the virus. So, we're taking up a little love offering for her because we know they've been through a lot. But her in-laws lived with them. So that was why they all were affected, not just her and her husband, but her and her husband's parents as well. We have several businesses in town that Sam and I have been working with that are of concern. We get complaints on our hotline, and we are seeing several businesses with multiple cases that concerns us. And we've reached out to them multiple times. I talked to the state today about them, and we're working on that to try and calm down the number of cases that they're seeing. So I'll keep you posted on that. There's three in particular, really two, that worry us the most. And we are trying our level best to get a handle on those. We do have one outbreak in a nursing home, that's Universal Health Care. They have 3 residents who are doing fine, by the way. Those residents are doing well. And they have 5 staff that were affected. So I cannot tell you how proud I am of our long-term care facilities. They are doing a fabulous job. And that is not I don't know if it's because of we're just lucky or they're doing such a good job or both, but I am so glad that we've not really had a terrible outbreak in any of our long-term care facilities. We do have 2 other facilities that we're monitoring. They are facilities that have 1 case apiece, and the state requires that we monitor them for 28 days to make sure they don't get another case, because once you have 2 cases, the state's definition of an outbreak is 2 cases in a long-term care facility. So right now we just have the 1. We're watching the other 2. Their 28 days will be up May 20th, and the other one has ways to go yet. So they will probably be, I don't know, toward the end of the month. And then they will be okay. Any questions about what's going on with COVID-19 or what we're doing? Okie dokie.
Do you want to share the graph with me?
Oh yeah, can we? How do we do that? So Tara put this graph together. One of the, you get a graph in your SIT report that you get every day. But this is a graph that the state is also using to measure what's going on. And it's a 7-day average of cases, new cases. And we'll have it up in just a minute.
Susan, while she's pulling that up, in Randolph County, do you see the majority of this in clusters, or is it fairly widespread across the county?
It's widespread across the county. It's from one end to the other. It's from Archdale Trinity over to Liberty, down to Seagrove, down Ramseur, up in Randleman. It's widespread.
Yeah, it sounds like it.
Yeah. And you can go on the state's website and hover. It's really tricky when you go to look at those zip codes on the state website. You have to kind of hover over areas in Randolph County, and the number of cases will pop up. So you can kind of see how many cases there are within each area of Randolph County. The majority of the folks who have been affected tend to be, you've seen that in your SIT report in the, I forget. A little bit younger than me, but not a lot. That's hard to read. The 50 to 59-year-old group, that tends to be where a lot of the cases are. And I can tell you the 6 deaths we've had, one individual, well, 2 individuals were over 60. The other 4 were they're in their late 40s to early 50s.
Late 40s.
Yes.
Wow.
So just so you know, this graph is a 7-day average of new cases, and they're using this on the state level to see how things are kind of the rate, how things are kind of slowing, if things are slowing down. We've kind of had a little peak the 1st of May. We'll see how that goes. It may or may not slow down. I hope it does. But we have been on a pretty uphill climb here lately. We usually average anywhere from 12 to 20 cases a day. Now today, when you looked at your situation report, it said 8 from the previous day, but by the time today's over with, we'll have several more cases. So anyways.
Susan, I have a question. It's Amy.
Yeah.
Okay. So I've been watching situation reports too, and I was just curious. You know, we were kind of just going along a bit at a time, a few cases here and there. Then it did rapidly go up, it seemed like. Is that just the trend of it and the normal way that it goes? Is it due to maybe these companies having higher numbers? Like, what's your thought on that?
I just think it's according to the county you're in. And when they had the outbreak at Mount Air Farm in Dollar City, that spilled over into Randolph County. And we started seeing our numbers increase then. And so that does make a difference. I think if you're in a county where you don't have any industries and, you know, you don't have people working real close together and that kind of stuff, that does, you know, that's a little different. But if you look at Chatham County's numbers, they're worse than ours, and it's a small county. But yes, I do think, and that's why we're working so hard with these businesses to get them to help us get a handle on what they've got going on in their facilities. So yes, it does make a difference.
There's also increased capacity for testing.
Thank you. And Tara just made the comment, there's also an increased capacity for testing. So, you know, y'all haven't heard me say this, but I say it every time we have a countywide crisis management team meeting. I don't know if it's because we're testing more or we're just getting more exposures. I think it's probably a little of both. And we do know testing is going up. If you listen to Mindy Cohen when she talks, it's clear statewide that testing is increasing, and we know that local providers are doing more testing. So Tara's right, it probably is partly that. I'm real concerned that when we start relaxing these, you know, these social distancing measures, our stay-at-home orders, and all this starts relaxing, that we're going to see an increase in cases. I just feel confident that we will. And I think if you look at if you're watching the news and you look at what's happening around the world in those areas where they are doing that, and even in the United States, they are seeing numbers start to creep back up. So, you know, I think we're kind of in it for the long haul, as much as I hate it. I don't know how we can get away from it. So, anything else about COVID?
What are you, when you're working with the places of business that are having issues, what type of actions are you doing? Is it mostly educational or really pushing them toward precautions?
Well, we've been doing a lot of education, providing a lot of guidance, offering our assistance in terms of if they have a lot of Spanish-speaking individuals, offering assistance with language as well. We are getting to the point where we're going to start pushing a little harder. We have a connection with OSHA now, and we've been talking with them. And I had a conversation with the state today and with our county attorney, and we will be looking at other things we might be able to do that's a little harder, not so soft, a little more direct. I've requested their policies on how they're managing their employees, You know, what are they doing? Are they screening them? Do they do temperature checks? Are they, what are their cleaning policies? That kind of stuff. So I've requested those today. So we're just getting down a little more, you know, to brass tacks. What have you got going on, kind of thing. They keep telling us they're doing it all, but we'll see what their policies say if they have any. We'll see. There was, you know, at one time you probably, if you've been watching things, you've been seeing things about Technomark. Technomark has done a fabulous job. They have done an outstanding job mitigating their issue. And Tara worked exclusively pretty much with them to help them get stuff situated. And so we're just real pleased with the outcome that they have taken this seriously. They've owned it, and they have done a really good job mitigating their issue. They are a model, in my opinion. We send a lot of people to talk to them because of all the stuff they've done. And I wish some of these other folks would take note of that. But we're trying to get a little more firm with them, Julie, and try to get them to listen to us from a different standpoint. Okay. The other thing I wanted to add tonight in my report is that we received our cost settlement money for last year, for fiscal year 2019-20. It's actually this year. It was 2018, right? It's 2018 cost settlement, but we've just gotten it into this year's budget. And that was $315,401. So we are thrilled with that. The reason we were able to do so well was our dental services. And dental is taking a big hit right now because they're not seeing anything but emergencies right now. And so this money will help sustain them. Not all of it can go to them. We have to put that money back into the programs that it was earned. So some of it was dental, some of it was family planning, some of it was immunizations. Primarily dental and family planning. So that was good. The other thing is we understand that there is $2.5 million coming to, I've got notes somewhere, I'll put them. $2.5 million has been awarded to the county as part of the federal coronavirus relief fund. It will be coming through the state to the county, and public health will get a portion of that. I don't know what that is at this point, but the county desperately, we are in a, you know, revenues for everybody. I mean, y'all know you're got your own businesses or you're involved in companies that are suffering the same. So, you know, but that money is coming. I don't know all the details about that. The only other thing I have is that we've got new board members and we're thrilled. So, hey to the new board members, Ryan and Carrie, and who is our other new board member?
Amy.
Amy.
Hey,
Amy.
Amy. I can't see you all at one time for some reason. So we need to do some orientation for y'all, and that will be coming. Tara will get that put together, so you should be looking for an email from her about that. Most of that, since we're in the situation we're in right now, and when all this is over, you can come hang out with us. But most of it will be online, so it won't be hard for you to do. And we will also be setting up email addresses for you. You need a county email. And the reason for that is it's I always go back to the Hillary Clinton thing where people are in public service using their personal emails for county business or state business or White House business or whatever you have it. So we'll get you a county email before long. So be looking for that as well.
So you're gonna divide the 300,000 between the 3 new members?
Yes, Ron, that's exactly
Okay.
what we're doing.
Have you had COVID? Did it affect your head?
It's probably breathing through the mask,
It's
CO2.
about to infect mine, I tell you.
I know the feeling.
Yeah. So that's that. Tara, can you think of anything else? Can either of y'all think of anything else? So does anybody have anything else for me? Well, thank y'all so much. Carrie left, but I love her picture. She's got oh, there she is.
I'm juggling quite a bit right now.
All right, we're so sorry. All right, that's my report, Chair, Mr. Chair.
Thank you. Board members, I'd like to just share a little bit of praise and thanks for Susan and her staff. I mean, the Emergency Operations Center opened up on the 4th of March, and so they've been over there for the last couple months, and they've been working tirelessly, like she indicated, day and night, to take care of the citizens of our county. And then they moved over to the Operations Center at Emergency Services on the 17th. And I know as the largest employer in the county that we rely on this resource quite a bit. We've reached out to them multiple times. So Susan and your staff, I just say thank you on behalf of the citizens here. Also, board members, if you haven't seen the new at a glance that's at the very bottom of your report that you're getting from Tara every day, I brag on you. I love this at a glance because it's got a lot of information on it. If you haven't taken a look at it, please do so. As Susan indicated, some of the individuals that are highly impacted are your 30, 40, and 50-year-olds. Seem like the 60 plus are doing really well and the under 19 are doing really well. So it's our working group that may not be doing as well. And this is also the same folks that some of our people out there are saying are smart enough and wise enough to do what needs to be done and take care of themselves. And I just caution them to make sure that they are doing what they need to be doing to take care of themselves, because our numbers continue to grow. We continue to see deaths in the county, unfortunately. And so this is something that we need to be highly cognizant of as how it's being spread and the things around it that we can do to protect everybody that's involved and not capitalize on the situation, but work together on both sides. And it's for both parties need to work together and do what's best for everybody involved. And so I certainly hope if you don't realize what they're doing, that you'll take a moment to read these reports and see all the work that goes into it. And so Susan and Tara and everybody, I certainly appreciate all that you're doing for us during this crisis, because on top of their daily work, everything else that's going on, this is on just another layer of what they're being able to do or having to do. So I commend you and I appreciate all that you're doing. Any other board comments before we make a motion to adjourn for tonight?
I would just like to say, Courtney, on behalf of the board, Susan, we would just like to give our prayers and lift our prayers up in condolences to the staff member that lost her husband and her father-in-law. That is a life that, you know, we just can't take for granted. And our prayers are just with the family as well.
Thank you, Courtney.
Yeah, God bless them.
Thank you.
Marty, this is Lynn. I think at some time we ought to do something, and it doesn't have to be anything large, just to say thank you to the whole health department, because they've done a lot.
Yes.
And whether
I
we
was
just
thinking the same thing. How do we do this?
bring cookies or ice cream or something to them at some point in time, I think we need to just show up and do something.
Needs to be little. We can't take big prizes, but little's okay.
Well, I was wanted just a cookie or something, or just a thank you.
Can we even show up to the EOC center with goods?
Yeah.
If you call and let us know you're coming, we can meet you there. Yes.
Okay. How many people are at the EOC at one time, roughly?
What? 13, 14, 13, 15.
All right.
Okay. Okay.
Board members, if you're interested, I'll reach out to you guys and then see what we can put together, and then we'll talk with Susan on a date and time. Does that work?
That sounds good.
Okay, I'll do that for you.
Thanks.
Any other comments or concerns you want to share? Carrie, I know that you're also dealing with a death and you know, someone close there, so we appreciate you being online tonight with us, and certainly our thoughts and prayers are with you and your family.
Thank you. Thank you.
God bless you all.
Anybody else? All right, do I have a motion to adjourn the meeting?
I move to adjourn the meeting.
All right, Robert's motion. Do we have a second?
I'll second.
Okay. So this time I'll call each individual member like we've done the previous 3 votes. Courtney,
Aye.
Robert,
Aye.
Mary Ann,
Aye.
Carrie,
Aye.
Julie,
Aye.
Lynn,
Aye.
Ryan,
Aye.
Mac.
Aye.
I vote aye. And Amy?
Aye.
All right. Meeting's adjourned. Thank you, guys.
Thank
Thank
y'all.
you.
Be safe, everybody.
Bye.
Bye-bye.
Till we meet again.